Hi, everyone, and welcome to the second session of our Day 4 of Kidney Action Week. We hope you've been enjoying the content so far, and we're excited for another great session. My name is Lauren Andracchio, and I'm an Associate Director of Outreach and Strategic Partnerships here at American Kidney Fund, and I'm honored to be your moderator on this session on family planning and kidney disease. During today's session, the panelists will cover topics including the associated risks of pregnancy on overall health for someone living with kidney disease, challenges with fertility, and the impact of genetic testing and counseling on health and family planning decisions. In addition, we will have two individuals who have navigated the road through family planning with kidney disease and are here to share their stories. Now I'd like to welcome the panelists. I'd first like to introduce Dr. Jessica Tangren. Dr. Tangren is an attending nephrologist in the renal division at Massachusetts General Hospital and an assistant professor of medicine at Harvard Medical School. Her research and clinical work focus is on kidney disease and pregnancy. She leads a subspecialty center at Massachusetts General Hospital focused on women's kidney health. Welcome, Dr. Tangren. Next, we have Dawn Laney. Ms. Laney is an assistant professor and genetic counselor at Emory University in the Division of Medical Genetics. Ms. Laney received her master's degree in medical genetics from Sarah Lawrence College in 1999, and she received her certification from the American Board of Genetic Counseling in 2002. Since joining the Emory Division of Medical Genetics in 2002, Ms. Laney has been involved in the follow-up of abnormal metabolic newborn screening for the state of Georgia, development and management of Genetic Infusion Center, and lysosomal storage disease clinical care and research. She is currently the program leader for the Emory Lysosomal Storage Disease Center and the director of the Emory Genetic Clinical Trial Center. Ms. Laney teaches developmental biology and human malformation course in the Emory and Northwestern Genetic Counselor Training Programs. Welcome, Dawn. Next, we have David Rush. David is a platinum-selling recording artist formerly signed to the Pitbull's label Mr. 305 Inc. As a former in-center and currently using home hemo patient on the Tableau dialysis machine, he is a one-time transplant recipient and truly knows what it means to live life with chronic kidney disease. This point was proven while as a patient, David took his home hemodialysis machine on a 40-city world tour in 2009 with multi-platinum artist Pitbull as an opening act. David serves on the boards of the Northwestern University George M. O'Brien Kidney Research Core Center, also known as New Go Kidney of KidneyX and the American Society of Nephrology. In 2022, David was awarded the American Society of Nephrology President's Medal for his continuous advocacy work. Wins only is David's battle cry to remember every day is a win and to live life to its fullest. Such a great mindset to live by, David. Welcome. And finally, we have Shayla Harris. Shayla is a kidney transplant recipient, the Associate Director of Administration at the American Kidney Fund, and a proud advocate for the 37 million Americans with kidney disease. Shayla was diagnosed with end-stage renal disease in October 2009 and was in need of dialysis or a kidney transplant. Fortunately, her sister was a perfect match, and on February 24, 2010, Shayla was given the gift of life by receiving a kidney transplant. Shayla is a proud American Kidney Fund ambassador and has testified numerous times at the Maryland State Capitol in Annapolis, Maryland, and on Capitol Hill in Washington, D.C. on various kidney-related legislation. It has been 13 years since her kidney transplant, and every day Shayla lives her life to the fullest due to her gift of life and will continue to be one of the many voices for the 37 million Americans with kidney disease. Welcome, Shayla. As you can tell, we have a great group of panelists for today's session. Before we get started, I just wanted to encourage everyone to put your questions in the chat. We have a Q&A section at the end, so we will try to get to all of your questions, as many questions as we possibly can. But go ahead and put them in and keep them coming. To start us off, I'd like to turn it over to Dr. Tangren. Dr. Tangren, could you please provide an overview for the audience about what pregnancy means for women who have kidney disease?
Great. So having a child is a life goal for many women, and having a chronic illness does not change the desire for motherhood. Next slide, please. Chronic kidney disease affects upwards of 3% of reproductive age women in the United States. And because women are having children later in life, it's anticipated that the number of women diagnosed with kidney disease before starting a family will only increase. In almost all cases, kidney disease does not represent a barrier to reproduction, but kidney disease prior to pregnancy does increase the risk for complications in pregnancy, like preeclampsia and early delivery of the fetus. Pregnancy can also accelerate the progression of kidney disease for some women and may hasten the need for a kidney transplant or dialysis. It's no surprise then that issues surrounding reproduction in women with kidney disease is challenging, and women with CKD can face difficult decisions when deciding whether to start a family. Many women planning a pregnancy will likely grapple with how the pregnancy can affect her own health, the health of her offspring, and additionally, what burdens this may put on her family members or her support network. Next slide, please. I want to share with you some quotes from my own patients who have struggled with decisions around family planning with their chronic kidney disease. I was diagnosed with CKD from my autosomal dominant polycystic kidney disease 2 years after I got married. If my husband had known I may not have been able to have children, I wonder if he would still have married me. I remember overhearing my pediatrician tell my mother that I should never have children. This feeling of emptiness has been with me my whole life. I don't think he realized the impact those words have had on me all of these years. Am I selfish to want a baby? If something is wrong with the baby, it will be my fault. I'm not sure I can live with that. If you are a patient with kidney disease who's watching this presentation, I want to let you know that you are not alone if you've had concerns or anxieties around starting a family. Next slide, please. So women with advanced chronic kidney disease experience high rates of subfertility and infertility. Women with normal or mild impairments of kidney function often continue to have normal menstrual cycles. However, once their GFR drops below 15, menstrual irregularities are quite common. And for women who end up on dialysis, many will stop having periods altogether. For women on dialysis who do still get their period, most have what are called anovulatory cycles, which means that although they still have menstrual bleeding, an egg is not released by the ovaries, and therefore conception is not possible. Despite this, pregnancy can occur at all stages of kidney disease, and normal menstrual cycles can resume as early as 6 weeks after kidney transplantation. Additionally, women who begin more intensive types of dialysis, including dialysis at home or overnight in-center dialysis, can start to have normal menstrual cycles. Because of this, it's really important that women with CKD use some form of contraception to prevent an unplanned pregnancy. This is especially true for women who have had a kidney transplant or who receive therapy for certain glomerular diseases, such as lupus, as certain medications can be harmful to the developing fetus. Next slide, please. When I meet women with kidney disease who want to have children, the two questions that are often at the front of their mind are, 1, will my pregnancy impact my kidney disease? And 2, will my kidney disease impact my pregnancy? And the answer to both of these questions, not surprisingly, is yes, but the chances really depend on how advanced your kidney disease is before pregnancy. The best research we have on how pregnancy affects CKD progressions suggests that women with very advanced stages of CKD are at higher risk of worsening CKD during or immediately after pregnancy. In a study from 2 very large hospitals in Italy of over 500 women with various stages of CKD who were followed during and after pregnancy, women who had early stage CKD, so CKD 1 or 2, only about 8 to 13% of women had worsening of their kidney disease as a result of pregnancy. However, women with more advanced stages of CKD were more likely to lose kidney function, with about 1 in 5 women with CKD 4 or 5 ending up on dialysis as a result of their pregnancy. Next slide, please. These studies are far from perfect and have major limitations, however. In both cases, they follow small numbers of patients and really do not represent diverse ethnicities. Next slide, please. So how can kidney disease impact a pregnancy? I want to spend a little bit of time discussing preeclampsia, which is a disease that is unique to pregnancy. Preeclampsia occurs in 2 to 5% of healthy women in the United States, but can be seen in upwards of 20% of women with chronic kidney disease. And really, this is the main complication that I worry about in my patients with kidney disease who are pregnant. Preeclampsia occurs when the placenta does not develop properly. It's diagnosed in healthy women if they develop high blood pressure or have protein in their urine after 20 weeks of pregnancy. But many women with CKD already have high blood pressure and proteinuria, and this can make preeclampsia really challenging to diagnose in pregnancy. There are currently studies underway looking at different markers in the blood that may help us distinguish preeclampsia from kidney disease, but these tests unfortunately are not ready for use in the US currently. Currently, the only treatment for preeclampsia is delivery of the baby. And if delivery is required before the baby reaches full term, this puts the offspring at increased risk for the complications of prematurity. Multiple studies have demonstrated that low-dose aspirin may reduce the risk for preeclampsia in women at high risk for the disease. And so as a result, I routinely recommend starting aspirin early in pregnancy for women with CKD. Next slide. So in my last few minutes, I do want to leave you with some signs of progress. My colleagues and I recently published this large study looking at pregnancy outcomes in women with kidney disease from the province of Ontario. We were able to study more than 500,000 women, which is almost 10 times as big as the next largest study looking at CKD outcomes in pregnancy. And the main take homes are is that fortunately we've made huge improvement in both neonatal care and in the care of CKD that makes pregnancy complications in women with CKD much lower than previously reported. We found much lower rates of preterm delivery for women with CKD, and the risk of needing dialysis in pregnancy was quite low as well. What we did observe is that it's not just your GFR or CKD stage that matters, but also things like having high blood pressure or having high levels of protein in the urine. And really what we observed is that the combination of high levels of protein in the urine with a low GFR was associated with the highest risk of having a poor outcome. Next slide, please. So to conclude, my goal for patients is that they feel like they're living with kidney disease and not merely surviving. And for many, this means having a family. So I encourage everyone to talk to their nephrologist. And if for some reason she or he is not comfortable talking with you about your reproductive goals, then find someone who is. Pregnancy planning takes time, and your nephrologist can help you identify the safest window within your CKD trajectory to try and conceive, and to work with your other healthcare providers to optimize your pregnancy.
Thanks, Dr. Tangren, for sharing that research. Those quotes you shared were really profound and really speak to the emotional experience of women with kidney disease as they navigate this journey. So, Dr. Tangren, you were talking about, a lot of your research and your focus is on women with kidney disease and pregnancies. Since we do have David on the panel, could you share a little bit about the experiences and the challenges that men with kidney disease face when considering, having children of their own?
So I'll say that most of my patients are women, but I also take care of all stages of CKD in men as well. And the hormonal and vascular changes that happen as kidney disease progress affects fertility in women, but can also affect fertility in men. And so these are also important issues for men, and there are high rates of difficulty conceiving in men with CKD as well. And we look forward to hearing of David's experience overcoming that.
Well, thank you. So before we transition to Dawn Laney, I would like to just take a moment and, for the audience, for those of you who are just tuning in, welcome to our session on family planning and kidney disease. A reminder that we will have a Q&A segment at the end of today's talk. So please feel free to put your questions in the chat and we will do our best to get to them. So now, I'd love to hear from Dawn as she, is the genetic counselor. I'd love to hear your perspective. Dawn, would you be able to share a little bit about your role as a genetic counselor, an overview of genetic testing, and when is the best time to talk to a genetic counselor?
Sure. Thanks so much. So I'm a genetic counselor, and that means that I'm a healthcare professional that focused on learning about genetic conditions and learning how to convey complicated information about medicine and genetics to patients. So the best time to talk to a genetic counselor is anytime. And I loved what the previous speaker said about this all being a marathon and not a sprint. As you may know, there are inherited causes of kidney disease. And if you are unsure if you have an inherited form of kidney disease, that's a great time to start talking to a genetic counselor, because a genetic counselor can help you figure out if there's clues within your health or your family history that would suggest that maybe there is an underlying genetic condition that could cause problems, not only with pregnancy, but fertility or anything else that you probably need to know before you go into a pregnancy. Setting aside the physical implications of having a genetic disease and talking about pregnancy, there's also the chance you could pass a genetic condition on to your children. I work in Fabry disease, which is just one inherited cause of kidney disease. And in Fabry disease, I have a combination of patients. I have some patients who they're like, I'm having kids, and they don't want to do much prep. They just want to see how pregnancy works for them, and they go forward with that. I have other patients who really are information gatherers. They want to know if they have a genetic condition, what's the chance they could pass it on, what's the chance that it could impact pregnancy and pregnancy management, and they want to know what's the risk for like their mother's, cousin or their sister or their brother. They really want to understand the implications on the full family. Going to genetic counselor is a great time to learn about all those implications. And even if you are one who just wants to go ahead and just get pregnant and see what happens, talking to a genetic counselor before you get pregnant is a great idea, because it helps you get the pieces of information you want so you have them to access if ever you need them. Just for an example, I have a patient who her father had Fabry disease. She had Fabry disease, and she was not currently having any kidney problems, but she wanted to learn more about what's the chance of having problems during pregnancy. And what we can do is go into the studies that have been done, nowhere near the big studies like we were just talking about, but looking to see, and if a subset of women who have a genetic condition, what complications should we be looking for in pregnancy? What should we be concerned about? So you just heard a couple complications that could happen with overall women with kidney disease, but about women with a genetic disease that could have kidney implications but haven't had it yet. And that's where looking in the literature, a genetic counselor and a geneticist can look through and say, oh, I see from this article from this one author that when they looked at multiple pregnancies, pregnancy outcomes seem overall really good. The only things to look for is increased neuropathic pain, increased protein that's not related to preeclampsia, or issues with increased gastrointestinal things with diarrhea and constipation. So let's plan to have you work with a high-risk baby doctor or maternal fetal medicine doctor who can really be watching for those symptoms, planning out the path that if you have them, what we can do or what we can't do during the pregnancy, and really helping people have the best pregnancy experience, as well as thinking about the outcomes. Genetic counselors are really good at drawing out family histories. We still use pen and paper sometimes, but sometimes we use electronic things. And what we're looking for is, if we find something that looks like it could be genetic, talking to you about how we do genetic testing. So genetic testing is not the same, no matter how you do it. And one of the important things to do is understand what the options are for genetic testing. Is it a great big panel that's looking for all sorts of causes of genetic disease? Or is it one that's focused on causes of genetic disease that could cause kidney disease? Or is it a panel that's just looking for things where both parents have to have it and pass it on to cause problems? And that's where a genetic counselor can walk you through all the options and learn from you. Do you want to just test for this one genetic condition? Do you want to look and see what the risk is for other conditions that you may not realize are in the family? And then when you get results back, they can interpret the information and what it means to you, your family, pregnancies, and anything else related to that you have questions on. They can also connect you with great groups. When we talk about the amazing work that the American Kidney Foundation does, it really helps you figure out what are equivalent groups that you can keep in touch with both groups. That plus maybe a disease-specific group. So helping identify resources and understanding what's going on. As I mentioned, just because you have a genetic disorder or a condition does not mean that you're automatically told not to have children. Just like we were talking about with women with chronic kidney disease, having a genetic condition often means that you can have children and have successful pregnancies, but you need to talk to somebody to understand what that means for you. And a lot of times what we do is we talk about, just like those stats we're looking at with the last speaker, what is the chance of women who have problems during pregnancy and how do we think about it? Before women become pregnant, there is one way if someone has a genetic disease running in their family. If we have genetic testing that knows the gene change causing the disease, we can look for that through a method that's basically like IVF. So you take the egg and the sperm and you do IVF to stimulate and get those different, to harvest those together. You go ahead and start making embryos. And then when they're just in the small stage, if someone is interested, they can test to see if that genetic condition is existing within that particular embryo. And then a parent can decide, depending on the condition, to reimplant those with the genetic condition, those without the genetic condition, or those who are carriers for a condition, depending on how it's inherited. And again, knowing ahead of time is key because getting the genetic testing done, identifying someone who could work with you to do the pre-implantation genetic testing, and then working with you through the whole pregnancy and the pre-pregnancy planning is the marathon part of the pregnancy in this case, as opposed to the sprint. So once you're pregnant, there's of course nothing we can do to change whether or not a baby has a genetic condition, but what we can do is prepare and understand what it means for, the baby's childhood and future health and development. So some people like to test the baby before they're born through prenatal genetic counseling. So prenatal genetic counseling is usually invasive. And by invasive, we mean that we have to go in and get some of the fluid from around the baby or take a small piece of the placenta. And which test you do depends on the timing of how pregnant you are and when you want to learn. And a genetic counselor is a great person to walk you through options that you can do for testing during pregnancy, before pregnancy. And if you wanted to wait, you don't have to test babies before they're born. You can always test after they're born. What's the best timing for that as well? So long story short, when you're thinking about pregnancy, and if you look at your family history and think, well, maybe this is running in my family, or I wonder if these symptoms, these health problems I have, plus my kidney disease, mean that I could have an underlying genetic condition, that's a great time for genetic counseling. If you're thinking about genetic testing, great time for a genetic counselor. Don't understand your genetic results, genetic counseling time. Or if you're trying to understand all the options and the impact inheritance to a baby. Again, genetic counselors can be really helpful there. So I encourage, there's both genetic counseling that's in person and virtual. So this is something that anybody can access and you just have to know how to do it.
Well, thank you so much for giving some background information on genetic testing. You just mentioned the word access, so I'd like to get into that. Do health insurance companies cover genetic testing and counseling? And for those that don't cover that, are there resources to make this more accessible to all?
Mm-hmm. Absolutely. So there's a couple great ways to access genetic counseling. The first is that insurance do usually cover genetic counseling. The second is sometimes genetic counseling is lumped in with a medical visit, whether it's an OB/GYN visit or a visit with a geneticist or a visit with a specialist who happens to have a genetic counselor who works with them. The other way is some of the testing programs where they look for possible genetic causes of kidney disease or other things are also associated with genetic counseling services. So that's something you can look for when you get tested or talk to your doctor about is say, hey, can I have prenatal genetic counseling as part of the testing? Because that is considered sometimes a package depending on which test is done.
Okay, thank you so much. For our audience, for those of you who just joined in, welcome to our session on family planning and kidney disease. As a reminder, we do have a Q&A section at the end of our talk today, so please feel free to drop your questions in the chat and we'll do our best to get to them. So now I would love to, we heard from two expert speakers, Dr. Tangren and Dawn. I'd like to turn it now to one of our individuals who has lived through this experience. So David, as someone that, lives with kidney disease, is on dialysis, had a transplant, and you fathered two children. Can you please share with us what your personal experience has been like?
my personal experience, this has been probably similar to a lot of different patients out here, similar to crashing into dialysis, not really understanding what was going on with my body at the time, waking up on dialysis and learning that it was something that was going to be with me for a lifetime. I've been doing dialysis since 2006. I was diagnosed all the way in 10th grade when I had protein in the urine. So that kind of started my journey then. Then, when it came time to getting older, getting married, the woman that I asked to marry me was actually my girlfriend from high school, who was responsible for even finding that my creatinine levels were so high and everything. She was working in an internal medicine group, and I went and got a physical done at her job. And that's how I kind of found out that my kidneys were certainly failing at that time. So my personal experiences kind of just brought me to the point of just trying to understand what dialysis was. I remember when I was 24, the doctor gave me a year to live if I didn't start dialysis. So it was a scary time for me for that year. I actually woke up on the machine after passing out after work one day and kind of got sent to the hospital. And that's when I kind of woke up doing dialysis that day. Some of the things that were told to me about as far as with children is that there's a possibility because of how sick I was, I wouldn't be able to have children. So it was a very scary time for me. Again, asking this girl to marry me and knowing that there's a possibility I wouldn't be able to produce children with her. I always wanted kids. And so it was a big thing for me. I was very scared at the time. And I asked her, pretty much to leave me before we got married, because I just thought maybe, who would want to stay with me as far as going through dialysis and might not be able to have children. And I just saw a lot of red flags for myself. So when I asked her to leave, she told me no. And, she was in with me for the long haul. We eventually ended up getting married, which was amazing. And I did receive a kidney transplant November 9th of 2010. When I got that kidney transplant, was actually from my brother. And so when he gave it to me, I want to say, I always make a joke that our television wasn't working at the time, and, things happened. And she came to me one day, and my brother-in-law was actually about to have a child with his girlfriend. And she had two baby bibs. One was pink, one was blue. And she said, "Which one do you like?" And I told her, I was like, "Oh, well, he's having a girl, so it only makes sense to give him the pink one." Thought it was for him. And she was like, "Yeah, but which one do you like?" And I said, "Well, obviously, you want to give him the pink one. It's a girl. Why are you asking me this question?" And, of course, just not thinking. And she looks at me again and said, "Well, which one do you like?" And I said, "Well, if it was me, of course, I would want the blue one. I want a boy." And she goes, "Okay." She's like, "Well, we'll see what we're having." And I looked at her and I was shocked to hear the news that we were expecting our first child together. And, we had our son Maddox on September 22nd, 2011. And then 11 months, 11 days later, we had our daughter Shayla on September 11th, 2012. So the kidney was working. I almost got scared and took it out because it was working too well. But we had two kids back to back, and I was just happy to be able to be a father. And of course, very concerned about them coming out with kidney issues or anything. But they're good, healthy kids, 11 and 10 years old now. And, it's a blessing to have children and, just life in general. So I was scared that it was going to be a possibility I wouldn't be able to have children, with my wife. But, we have two miracle babies, and I'm just happy to be a father.
Well, what a sweet story. I've been giggling in the background because it's just very heartwarming to hear you, married your high school sweetheart. She stayed with you, when you said to leave her. And then I love the story about how she surprised you, and
Yes.
very sweet. So thank you for sharing that.
Definitely.
So, there are a lot of resources for women in general with family planning and fertility. What was your experience as a man with kidney disease? When you were thinking about having children, were there resources out there for you? Social support resources or, other resources to access to help you through. You said that your healthcare provider said it would be hard to have children. Did you explore that further, or, what was that process like for you?
I would like to say at that time, it really wasn't, unless there was, I didn't know of any, and there was none that were given to me at that time, unfortunately. now there's a lot of networks and things for men and women equally that you can see now. Before it wasn't like that. And, now we've kind of taken that step as society towards, equality and, things that are important to men are important to women, things that are important to women are important to men. So, there's a lot more of that now. But I would say, when we went to different seminars and when I asked the question about fertility and about, having children and, what was it that may block me from having kids and things like that. But there was no real network or anything for men like that at that time. So, it was really something I had to kind of wish and pray that it would change as time went on. Like when my daughter was then born, I kind of was just like, man, this is it. I got a girl, I got a boy, I got the set. I'm good. I don't want any more kids. These kids are expensive. So I was kind of glad that, we wasn't going to have any more after this one, man. But at the same time, it was just like so happy to be able to be a father to these children. And again, with my high school sweetheart, it was kind of something that we discussed a lot, but it really wasn't a lot of different things out there for men to even talk about, or, maybe it was a pride thing and we're embarrassed to talk about it or whatever the case may be. But I think now there's a lot more than there was then.
I think you're probably right. Thanks again for sharing your story. You clearly have your hands full or had your hands full with two young toddlers. So kudos to you for making it through those, I'm sure, long days sometimes. So I would like to transition to Shayla. So Shayla has, the experience of someone who has carried two babies to term and lives with kidney disease, had a transplant, went through the delivery process. Shayla, can you share your experience of what that was like for you?
Sure. It is my pleasure to speak with you all today and to share a little bit of my story. I've always wanted to be a mother. So after receiving the devastating news in October 2009 that I had end-stage renal failure, the first question I asked was, am I going to be able to have babies? My question definitely broke the tension in the room. And my nephrologist chuckled and said no one had asked her that question after receiving that kind of news, but that she would do everything that she can to put me in the best position to make it happen. So fast forward to February 24th, 2010, I received my kidney transplant for my sister. And I'd like to say that's when my marathon had started. After my kidney transplant, I had a new lease on life. And in June of 2011, I got married. And after a couple of years, my husband and I talked about starting a family. I spoke with my nephrologist to develop a game plan. And so the game plan was she had me stop my CellSup, which is one of the immunosuppressant medications I take daily, and put me on another medication, which was deemed safe for pregnancy. And we did that for a full year to ensure that I was able to tolerate the new medication. And then after that year, we were given the green light to start a family. Now, when we found out we were pregnant with our first child, we were really, really excited, but also quite anxious and nervous given all the potential complications that comes with pregnancy after kidney transplant. We had an incredible support system among the small group of family and friends we told, and our medical team was outstanding, and that consisted of my nephrologist, OBGYN, and the perinatal center at Washington Hospital Center in Washington, D.C., just all working together to make sure that, I was good, the baby was good, as well as the kidney. I was monitored very closely throughout my pregnancies, and I was fortunate to not have any adverse maternal complications. A decision was made in both pregnancies to induce me at 39 weeks. So in February 2014, we had our first son weighing 7 pounds, 9 ounces. We followed the exact same game plan as my first pregnancy. And so for our second son in September 26th, we welcomed him weighing at 7 pounds, 8 ounces. So with all that being said, my motherhood dreams have officially came true.
That's very sweet. And it's really sweet to hear, your initial response upon hearing such, really devastating news was that you wanted to make sure that you could become a mom. Clearly, you had your priorities, and
Yes,
and that's great that you were, had the reassurance from your healthcare provider and could work with them to make sure that everyone was healthy. Um,
absolutely.
so you mentioned a few different healthcare providers. You mentioned OBGYN, your perinatologist, also the high risk OBGYN. I imagine that having all the appointments with your general OBGYN and then on top of that, your perinatologist towards the end of the pregnancy became a lot. It's a lot
Yes.
of appointments. How did you manage that? Was it reassuring for you? Was it overwhelming? What was that like towards the end?
I definitely would say that it was reassuring. And I say that because, it's a very vulnerable time, this, childbearing process. So having the interaction regularly with the doctors definitely gave me, reassurance that everything was going to be okay. I was able to ask the questions that, I was concerned about, if there was, something felt different with my body or anything else related to, my pregnancy, having that constant interaction with the doctors definitely made me feel comfortable throughout the process.
That's great to hear that. Um, Also, most first time pregnancies, there is a lot of uncertainty. You've never been through it before, more anxiety. And I imagine, learning about all the additional risk factors could be overwhelming. It sounds like you had a supportive family and friends. Did you find support elsewhere? Were there other support networks that you reached out to help you through that pregnancy?
For the most part, I just definitely stuck with my family and friends and my medical team. It can be overwhelming, so I wanted to keep that village very small. And so just trying to keep myself in the best physical and mental space so I can, ensure that my pregnancy was as successful as possible.
And then for your second pregnancy, I think you said you followed a similar plan. Did everything go smoothly with that? Did you feel more at ease for your second pregnancy?
Yes, I think the second one, took the little bit of edge off because we kind of had done, the big part with the first pregnancy. But I think it was towards the end, I was getting monitored daily. And so I had my bag packed to be induced and ready to go. But that one day I went to the hospital. I didn't feel them, but I did have contractions. And each time my second son, his heart rate would drop every single time that I would have a contraction. So they ended up, sending me to labor and delivery a little earlier than I expected. But, I appreciated that caution and, delivery worked out very well, very smooth. So I think that was the only real hiccup, out of both of the pregnancies. But, I'm very, very blessed to have two very healthy, rambunctious little boys.
Well, thank you so much for sharing your story with us.
Thank you.
What a lovely short story. Now I would like to turn it to our question and answer section. So we have gotten some questions that have come in, and as we're talking, feel free to add your questions to the chat. We have some time for more. The first question I'd like to turn it to is Dr. Tangren. Can kidney disease get worse with multiple pregnancies?
Yeah, so pregnancy is a stressor on all of our organ systems. We during the 9 months of gestation, we're supporting the growth of the fetus, and that can put a stress even on healthy kidneys. And so there is some evidence or some data to suggest that with each subsequent pregnancy, there is potential risk of further acceleration of kidney disease, and really optimization of your kidney function and reduction in proteinuria and good blood pressure management prior to pregnancy reduces all of those risks. So that's why I stress talking to your doctor early. It's always better to know to plan for a pregnancy with kidney disease.
Thank you. The next one's for David. So someone's sharing that they're on dialysis and their wife wants some children. So David, did you have to change your routine? So diet, exercise, etc. when you started thinking about having children yourself?
Sorry. At that time, I was taking the medications that you take right after transplant. So my diet and everything was a little bit different at that time, but nothing, no major changes at all. Since I've gotten back on dialysis, I've changed my diet, for other reasons. But at that time, no, I didn't have any dietary restrictions. And, getting the fresh transplant, they want you to drink more and do more of what you couldn't do while you were on dialysis. So I was in that phase at the time. So no real diet restriction, no real major changes at all after the transplant.
Thank you. And for Dawn, how important is the time frame for newborns to be screened for genetic diseases, even if nothing showed in gene testing during pregnancy?
Oh, good question. So every baby in the United States is tested by newborn screening, but every single state tests for a different set of diseases. So in truth, there are not that many inherited forms of kidney disease that are tested for in newborns. So first thing that happens is depending on the state, within the first 24 to 48 hours after the baby is born, they get a little dried blood spot from the baby's heel. They send it to the state laboratory or wherever they get it tested. And then those results come back in the first week of life. In states that test for Fabry disease, that's pretty much the only one I can think of right now that would impact the kidneys. Then you'll get a result back pretty soon. And then you could see a geneticist and your doctor, and they tell you about that. However, those testing don't cover so many other genetic diseases. If there's a particular condition you're worried about, then you need to order it up separately from that newborn screening. When we're talking about a condition like polycystic kidney disease, autosomal dominant polycystic kidney disease, that's one of those things that you could discuss with your doctor about the timing and how it's been your family so far. And it's a good time for genetic counseling just to talk about whether or not you want to test when they're a baby versus when they're older. So we've got newborn screening in a little box that depending on your state, you get tested for a certain set of things, but then you also have the ability to test babies if you've got something that's going to impact them during childhood, but you want to think about it a little bit more if you're going to test them for something that happens in adulthood.
Okay, that's a helpful answer. Thank you. Shayla, were you nervous about switching medications after your transplant when you went from, I can't remember the name of it, but you went from one, you were taken off that before you decided to try to conceive. Were you nervous about that? And did you experience any issues when you were on your new medication?
Sure. Absolutely. So I was taken off Cellcept and put on azathioprine. I think I pronounced that correctly. And absolutely, before I got pregnant, my kidney was rocking and rolling. And so any type of change, it made me definitely nervous. And so that's why we decided to do that for a year, just to kind of work out any kinks that the new medication may have with me. So overall, yes, it was definitely nerve-wracking, but for the most part, once we figured out the right dosage, everything turned out pretty well. So the side effects I did have were just very minimal, just more so a little bit more fatigue that I had expected. And they couldn't equate that whether it was with because I could have potentially been pregnant or not. But for the most part, everything, that transition went pretty smoothly.
Okay. And this is a question for Dr. Tangren. For someone that would like children and finds out at an early age that they have kidney disease, would you recommend egg freezing?
Yeah, so that's a really great question. And I think that's where talking to your nephrologist about where you are in your trajectory of kidney disease can really help make that decision. I think for me, the hardest patients or the patients that I have the most concern about are those with advanced stages of kidney disease, like stage 4 kidney disease, who are not progressing rapidly, which is great, but are maybe later in their reproductive years. In many cases, if you have stage 4 or 5 CKD, we often recommend waiting until after a kidney transplant to think about starting a family. However, if you're later in your reproductive years in that area, you sort of might be out of your reproductive window by the time you have your transplant. And in that case, considering going through an IVF cycle and freezing embryos may very well make sense for you. Again, the one issue with that is that that's unfortunately not financially feasible for many people, and unfortunately, in many cases for kidney disease, we don't see that insurance will cover for embryo freezing, where they might in certain other conditions, like with certain cancers.
Thank you. And are there any resources like, grants or other assistance that people can apply for if their insurance doesn't cover that?
Yeah, the rules vary a lot state by state. I happen to practice in Massachusetts, where we have sort of great insurance coverage for in vitro fertilization. So I would need to do some more work for looking for outside of Massachusetts what options people might have.
Okay, thank you. Let's see. So someone's shared that their father and sister passed away from kidney disease, and now I have it. Dawn, is this genetics only? What are your thoughts here? And this is a very personalized story, but just your general comments here.
Yeah, whenever you have multiple family members who have kidney disease, it's worth taking a deeper look to figure out, when did they have kidney disease? Were there any ideas of what could have caused the kidney disease? And it's often worth talking to your nephrologist and a genetic counselor to really understand if the pattern in the family and the type of kidney disease and the progression of the kidney disease suggests there could be an underlying genetic condition. Some kidney disease appears in every generation, but it's not related to a specific gene that we can be like, oh, let's test this gene and we're going to know the answer. It's what we call multifactorial. So it's a little bit of gene, a little bit of environment, and then some other lifestyle things that go with it. So I would say, yes, if you've got a strong family history of kidney disease, absolutely talk to your nephrologist, talk to a genetic counselor, see if there's something that's indicated based on your experience. Because if we do find something, then that can make a difference. There are primary therapies now that if you have a specific genetic condition, there may be one of these that can help you keep your kidney longer and help other family members who might be at risk for the condition and then kidney problems as well.
Thank you for sharing that. For Shayla and David, do you have plans to have discussions with your children about kidney disease and genetic testing? Let's see. David, you go first.
Whatever you want me to do. Okay, I'll go for. Well, my kids, fortunately, they've seen me do dialysis at home for many years. So they are pretty adjusted to that lifestyle with me. We do talk a lot. We do discuss being healthy, eating the right things, exercise, and doing all that stuff. Because of course, I don't want them to be in the position that I'm in. I'm always telling them that prevention is better than cure. So I haven't had them genetically tested yet. I'm the only one in my family who has had any kidney issues, and I have a very, very big family. The only other person who did dialysis in my family was my dad, who unfortunately passed away in 2021, but that was from COVID. And he also had kidney issues very, very late in his life, I want to say around 74 years old. He had a bad case of pneumonia, and that's what knocked out the rest of his kidney function. So it wasn't like, he had kidney issues prior. So, me being the only one who's had kidney disease from this early, I'm hoping that it skips over both of them. But, at some point I will, do blood work and blood tests to make sure their numbers are good through their life, of course.
And I'm very,
Shayla.
yes. So my children know that their auntie is a superhero. They're boys, so they're very much into superheroes, and that she has the skill and the superpower to give the gift of life. So with that being said, they're aware of that, something that my sister had given me, the gift of life. The pediatrician is very aware of everything that I've gone through, and my husband and I have decided to get them genetic testing, once they get a little bit older.
Yeah, I would
Go
add
ahead.
in there that often the best way to figure out if there's genetic condition in the family is to start with the person who had the kidney disease And then if you find something, then you could test the children. I would start with the person who's the most likely to have a change that you can find.
Thank you. Dr. Tangren, back to you. There's more information out there on contraception and family planning for women with kidney disease. Why do you think that is? And maybe, David could also share his personal take on that as well.
Yeah, so there's been lots of advances in contraceptive technology within the past 20 years, and that's great. And I think that really benefits our patients with kidney disease. By far, the best, in my opinion, form of contraception for women with kidney disease who are trying to not get pregnant would be an IUD, and a progesterone IUD, like a brand name would be the Mirena. They work really well, and they don't cause problems with blood pressure. There's also progesterone-only oral contraceptive pills that, again, have no estrogen. And really, that's sort of the bottom line, is that most women with kidney disease probably should avoid estrogen-containing oral contraceptive pills. It can increase your blood pressure and increase your proteinuria, and two things that we're trying to avoid.
David, any comments to share there?
Can you ask the question one more time? I'll make sure I say the right answer.
Sure thing, no problem. So there's more information around contraception and family planning in general for women. And so the question is, why do you think that there's not as much information for men out there? What was your experience? I think you shared earlier that there wasn't as much social support. But do you have any thoughts about why that might be?
I mean, because the woman has the harder job. Honestly, you women are super. My wife, when she gave birth to our two children, she didn't use any medication. She went straight. I was looking at her like, I will never discredit you ever again. So you guys have the harder job. Women truly have, are a miracle and a blessing from God. Honestly, I mean that. I was brought up by, a lot of beautiful and hard working women. So I have a certain respect for my mother and my aunts and everybody I've seen who pretty much raised me. Along with my father later on in life. But I have a huge respect for women in their lives. So I can imagine it being more for women because you guys have the harder job than us. I think for men, I think what it is with us is just making sure when we do make these responsibilities and make these decisions with these women, that we're just there and supporting and making sure we do our part. But I do see it more for women. And I just do think it's because you guys have had the heavier lifting load on this one here. But as men, we just need to do our part as well because, it takes two to tango, of course. So we need to be around as well.
Thanks for sharing your take with that. Your wife is a superwoman.
Yes, she is.
Last question here. So does a transplant affect, so this is for Shayla, does a transplant affect how you prepare for delivery? Thinking about, natural birth, C-section, inducing labor, what was your experience there?
So for my first pregnancy, we went the whole entire time thinking that we were going to deliver via C-section. And then I would say at week 37, they pivoted and said, actually, you can do this natural birth. So that was a total mind shift. Definitely always staying prepared. So the first child, we had our bag prepared just in case I went into early term, like pre-labor. So that was definitely something that we were definitely prepared for. And so that's why the decision was made at 39 weeks. They induced me so we can have more of a controlled environment to make sure that we keep complications to a minimum.
Goodness gracious, that's such a change to go through, as you get into the later part of pregnancy, all of a sudden you got to do it on your own.
Right. And so that's why for the second one, I had asked, how is this going to happen so I can have my mind right?
Yeah, so you have some expectations there.
Yes.
Well,
yes.
Thank you everyone for answering our questions. So we're getting close on time. We have about 5 minutes left. So I'd love to take our last few minutes to ask all of the panelists for some key takeaways. So to summarize something to know, something to do about, our topic that we discussed today. So let's see. I'll start with Dr. Tangren. What's one thing to know and one thing to do?
So one thing to know is talk to your nephrologist early about your reproductive goals. Maybe not the first visit if you don't want or you don't feel comfortable with them yet, but it's never too early to talk to your doctor about your future planning. And even if that's children 5-10 years down the road. And the thing to do is if they don't support you in those reproductive goals, then find a new nephrologist who is ready to support you. And the message, even in my highest risk patients, should really be, it's not the right time now, but I hope that no one in 2023 is ever hearing you should never have children, because that's almost never the case. And it should always be, it's a not now, but let's get you to a point where you can.
Great advice, and that's a lot of hope to give. So thank you for that. Dawn, over to you.
Yeah, so I just want to second Dr. Tangren's answer. Nobody should tell you can't have children because you have a genetic disease. That's a personal decision you make for yourself. And if it's health-wise something you need to discuss with your nephrologist, then discuss it with them and go for that marathon. And then just know that genetic counselors are out there, and what they want to do is help you. And just try to figure out if genetic testing makes sense for you. And if it does, just describe to you what options are and what you need to think about in family planning and just with your family in general.
Thank you. David.
Number one, have a job, have some money, because kids are expensive. Number two, make sure you talk to your doctor. There's no question that's a dumb question. Ask every question you can. Stay off the internet. Talk to the doctor. Don't go to the internet route, because then you'll feel like you have 50 other diseases that you don't even have. And miracles are real. Hope is real. Love is real. And, a mindset and those things are also help, keep a healthy mind, an open mind, look at all options. And, being a father doesn't necessarily have to come from having a baby with a woman. There's other options as well, that you can love a child that may just need a family to love as well. So keep an open mind, open heart, and miracles are real, and just continue to be happy.
Great point. Thanks for sharing that. Shayla.
I would say the same. So ask those questions that you may have. No question is a dumb question. Be your own advocate. And also, if you and your partner are looking to start a family, ask around and do some research to find a medical team that you're comfortable with. Like I said before, this is a very vulnerable time, and you want to set yourself up as much as possible to be in the best mental and physical space where your pregnancy can be the most successful.
Well, thank you to all of you for sharing your personal insights and professional advice. You all have been a delight to be a moderator for today. So thank you so much for being part of this panel. I also would like to thank our audience. We've gotten so many questions and so many comments. I really appreciate how engaging you all have been. Tune into our next session. So up next, there will be a brief video featuring multiple American Kidney Fund ambassadors, and they'll be sharing their reasons why they're part of the program. So tune into that to learn more about that. Also, if you're looking for more resources on this topic in particular, we do have a resources page on kidneyactionweek.org. In addition, if you tuned in late to the session, this was recorded, so you can find this on youtube.com. And there's also key takeaway resources, so a resource that has an overview of some of the topics discussed today, as well as the resources. Follow us on Facebook or send us an email through kidneyfund.org to find out about more resources like this. And then once we conclude this session, you're going to see a link to a quick survey appear on a green button. Please take a minute to fill out this survey. This survey is really important to make sure that we're making next year's Kidney Action Week the best yet. We want to make sure that we learn about all the wins and all the things that we can look to improve. So please take time to fill that out. And finally, thanks everyone, and have a great day.